problem. And the same group, what I identify actually is also in patient aging around 60s, 50s and above. They identify the patient that did have actually reflux, an abnormal venous dynamic. They did have more abnormality in their brain. There's lesion we're calling. Again, the lesions are very different. You see white spots in the brain, could be MS, could be age-related ischemic. They did measure this and they found that subject having the problem with the jugular reflux, they do, and the more severe it is, more spots in the brain they had. So we cannot undermine this, and they do not have MS. Okay? Where are we now? We are now again back to the potential triggers for MS and our work. Our group, and I want to acknowledge Professor Murali Ramanathan, he's the director of our neuroscience lab, and Professor Ralph Benedict, that are our team work too, and we also want to acknowledge that we have Department of Defense grant and National MS Society grants to learn about potential triggers on developing MS and progressing of MS, in which again looking for infection, but we did introduce, and it's our absolutely devotion to go and see what CCSVI is doing as part of the multifactorial elements involved in MS. Again, environmental with vitamin D, smoking, and sure part of genetics. And we are from this direction, we are going together, and we are actually a very strong team, and we're really having multiple research, but this now is primarily our research with all the understanding what are the factors and what is the interaction in between them. Again, not only one can probably produce MS. And don't I finish here about on the clinical and genetics? I only raise about the genetic part. As you Professor Zivadinov raised already, we all know today that there is a part of the genetic, and this is one of the genes, the HLA. The HLA, what is the percentage HLA in MS patient? Around 60%. What is the same HLA in the healthy controls? 30%. Again, something that is not 100% and is clearly accepted today, that is probably a risk to develop multiple sclerosis. So now we change again.
I will just very quickly add what we know about our association studies in terms of MRI. We did correlate CCSVI with the most important feature of MS, which are lesions in the brains of MS patients. And we did not find correlation. We correlated CCSVI with another most important feature, which is brain atrophy. And we did not find in a very group sample correlation. However, we found correlation with amount of iron in the brain, with loss of the veins in the brain, with less perfusion, which means decreased metabolism in the brain, and with lower cerebrospinal fluid flow, which is ultimately draining into the jugular veins. So again, it's not black and white. Something that we expected to be a correlation, it's not there on a very large number of patients. On the other hand, those measures that are more related to the hemodynamic of our system, like cerebrospinal fluid flow, like iron deposition, like perfusion of the brain, those correlate very well with the severity of the CCSVI. So clearly, we can't abandon this research. We need to go forward and understand what this means for MS patients. And that's why we are doing other more risk factor association studies underway. So I will introduce here Professor Siddiqui, who will give you very exciting presentation of the study we are doing in collaboration.